People may crack their joints for stress relief, to make them seem more mobile, and even for the satisfying crack that comes from it. Even if you stand up from your chair, you may hear a popping sound from the knee joint. Joints are the places where two bones meet and can be joined by sesamoids, bones which are embedded in a tendon or muscle and aren't connected to another bone. There are three types of joints in the body, depending on how free they are to move. A fixed joint is where two bones are in close contact and are immovable, such as the sutures which join to make up the skull. Cartilaginous joints occur where two bones are held tightly together, but are slightly movable, for example, the spinal vertebrae. The third type of joints is synovial joints, which contain synovial fluid and are freely mobile. These make up the majority of joints, such as the knee and shoulder, and there are 6 further types. It is useful to have an idea of the anatomy of joints to understand where these popping sounds originate. The anatomy of a synovial joint consists of 3 predominant features: the articular capsule, articular cartilage, and synovial fluid. The articular capsule envelops the synovial joint and consists of 2 layers. The fibrous outer layer is made of white fibrous tissue that holds the bones together and lacks blood vessels. The synovial inner layer, sometimes referred to as a synovium, is a kind of connective tissue that absorbs and secretes synovial fluid. It also oversees nutrient exchange between the blood and the joint and is thus highly vascularized. The second component of the joint is the articular cartilage. This cartilage comes into contact with each other as the bones move past each other and has 2 functions: reducing friction and shock absorption. These become impaired with age, as the cartilage wears away as part of the normal aging process. Similar to the fibrous articular capsule, the cartilage is also avascular, thus relies on the synovial fluid for nourishment. The third component of the joint is the synovial fluid. This is a viscous fluid with a similar consistency to egg white, located in the joint cavities, and has 3 primary functions. The first is reducing friction, which it does by lubricating the joint, and the second is shock absorption. Synovial fluid is described as a dilatant fluid, meaning that its viscosity increases with applied stress. As previously described, the third function of the synovial fluid is for nutrient and waste distribution, exchanging oxygen, nutrients, and waste products with the articular cartilage. It is this fluid component of the joint that allows it to make a cracking noise when we bend our fingers back or crack our knuckles. Initially, there were numerous suggested causes as to what causes joints to pop. One of these was pneumatosis, also known as emphysema, which is the abnormal presence of gas within tissues as seen in chronic obstructive pulmonary disease or COPD. Another was cavitation, whereby pressure changes can cause the formation of low pressure bubbles within the synovial fluid. Other suggestions included the rapid stretching of ligaments, which are the fibrous connective tissue between joints, or the tearing of adhesions or scar tissue within the joints. However, through using methods such as MRI, scientists eventually determined that cavitation is what occurs when you intentionally crack joints, though the others can be causes of crepitus also. Cavitation is most easily performed in the hallux or big toe, knuckles, and neck joints. As the bones move apart, the articular capsule expands, causing a reduction in pressure in the space. Gases have reduced solubility in low pressure environments, therefore gases such as carbon dioxide, nitrogen, and oxygen dissolved in the synovial fluid form a cavity, which subsequently collapses upon itself, resulting in a popping sound. Over a refractory period of around 20 minutes, the gases redissolve into the synovial fluid, during which the knuckles cannot be re-cracked. Even recently, there has been debate as to how this mechanism produces a sound. In 2015, one study concluded that from the presence of bubbles after the joint had been stretched, that it is the formation of the cavity that causes the popping sound. However, this was disproved in a mathematical model 3 years later, in 2018, which showed that it is the collapse of the bubble that causes the sound. As previously mentioned, there can be other sources of joint or tissue noises besides cavitation. Crepitus is a general term which refers to grating, crackling, or popping sounds experienced either under the skin and joints or from air in the subcutaneous tissue, which includes cavitation. Bone crepitus occurs when the 2 rough bone surfaces move past each other, resulting in a grinding noise. This type of crepitus is usually caused when the cartilage surrounding the joint wears away, or from a bone fracture. Soft tissues can also produce crepitus when it contains gas that is not usually present there during pneumatosis. To be honest, the sources of most of the joint noises that occur during actions like squatting is uncertain. However, bone crepitus is usually a sign of fracture, and intentional knuckle cracking is a result of cavitation. Both of the other suggested sources previously mentioned are possible, such as a tendon sliding over an irregular surface or adhesions tearing. In terms of the short and long-term effects of knuckle cracking, To cut to the chase, multiple studies have concluded that it does not lead to an increased risk of arthritis. One study from a Californian physician who cracked one of his knuckles every day for his entire lifetime concluded that X-rays showed that there was no difference in joint physiology between his two hands. However, if the sound is coming from a tendon or ligament being stretched or snapped, then this can cause immense pain and should be consulted immediately. Apart from arthritis, there may be other concerns with popping joints, such as inflammation or a weakened grip if the joint is excessively and repetitively stretched beyond its natural position. Although it may feel that the joint is more mobile initially, there is little evidence to support this notion. The bottom line is that popping joints isn't harmful unless it is overdone, though the person will likely feel noticeable pain before this happens. There are also many other conditions which affect joints, including the two main types of arthritis. Osteoarthritis may occur when bones frequently come into contact, because as they rub together, the cartilage in between them wears away, causing stiffness and swelling. Symptoms usually occur in middle age and are experienced by most people by the time they are 70. The causes of osteoarthritis include joint stress, which may arise from overuse, playing sports involving notable joint stress, being overweight, and other joint injuries. The second type of arthritis is rheumatoid arthritis. Rheumatoid arthritis is an autoimmune disease that causes the joints and surrounding tissue to inflame. It has similar symptoms to osteoarthritis and can also commonly occur in the finger, hand, and foot joints. The causes are unknown, though it is expected that infection, genes, or hormone changes may be linked to the development of the disease. Despite this, it has been proven that smoking can worsen the condition and early treatment may reduce further damage. Don't worry though, you can keep popping your joints and wind up the people around you comfortably, knowing that it shouldn't cause any long-term damage other than to your friendship.